Welcome to this short introductory video on managing the behaviors associated with fetal alcohol spectrum disorder, or FASD. FASD is caused by prenatal alcohol exposure and is associated with a range of negative outcomes, including behavioral problems. Please watch some of our other videos to get more information on this disorder. This video will focus on some general principles on how to support and manage the behaviors associated with fetal alcohol spectrum disorder. The most important part about managing the behaviors associated with FASD is actually not about the behaviors at all, but rather about the person trying to manage the behaviors. You have to manage your own expectations and reframe how you see the behavior that is challenging. Alcohol does physical damage to the brain structures, and all behavior is an outcome of the use of these brain structures. If you expect someone with FASD to operate and perform at the same level as someone without these challenges, you are being both unrealistic and unfair. Accept that most of the time, problematic behaviors are a result of a situation or environment asking more from an affected individual than they are cognitively able to give. The environment must change to give them a chance at success. Most behavioral management comes down to making the cognitive load and requirements less, to enable an individual to use that which they have to the best effect. Sticking to routines and providing structure can have a massive impact. Routines make behaviors automatic, and when the proper behavior is automatic, it requires less thinking in the moment. If a bedtime routine always remains the same, it can become less of a struggle and even become automatic and happen without prompting. Routines and structure also decrease anxiety and uncertainty, which can also lead to problem behavior. Damage caused by alcohol means that affected individuals will struggle to form neural connections and lay down long-term memories. They struggle to link cause and effect and plan behavior based on previous experience. You have to accept that affected individuals will forget instructions and lessons may not stick from one day to the next. Repetition is key, and you must be prepared to say the same things over and over again. Do not wait for something to be forgotten before giving reminders. If something needs to happen, remind early and remind often as well. The same holds for routine and for structure. Keep reminding and keep repeating. Unwanted behaviors often occur when someone's cognitive control ability has been overwhelmed. Acting according to expectation and following rules requires the use of brain structures associated with inhibition and emotional regulation. Due to exposure to alcohol, these structures have been damaged and can only do so much. When a person is overstimulated or tired, inhibitory control and self-regulation become much more difficult, if not impossible. When this has happened, you cannot bring back control through punishment or through reasoning. In this situation, it is better to remove the person from the environment to a calm environment where they can regulate again and where they can calm down. As with all children, affected children learn how to behave by observing those around them. People around them model how you should and shouldn't behave, and they react accordingly. The damage that alcohol has done means that the individuals struggle with logical reasoning and abstract concepts, especially due to the damage to the higher order functions of the brain. This means that they will have a harder time understanding which behaviors are acceptable and not when it's explained to them. They will, for example, struggle to understand why they may be too young for certain behaviors if they see older people doing these things. This means that the individuals around an affected person must model the behavior that they want to see. If you want them to be in healthy, caring relationships, you need to model healthy and caring relationships. If you want them to eat healthy, you yourself must eat healthy. And if you want them to stay away from alcohol and substances, you must also stay away from substance use and alcohol use yourself. If you want them to regulate their emotions effectively, you must first learn how to regulate your own. Principles discussed here are universal. However, each individual can be affected in unique ways, and they may struggle with things that were not mentioned in this video. These universal principles will, however, help anybody with fetal alcohol spectrum disorder. For more personalized support, it's important to search out a medical specialist or therapist who knows about fetal alcohol spectrum disorder. To summarize, the most important thing to change is your own attitudes and behavior. Understand that the individual with FASD is doing their best given the damage caused by prenatal alcohol exposure. Keep things simple, keep things structured, and keep things routine. Focus on and reward the behaviors that you want to see. People living with FASD have so much to add to our lives. They've got love to give and they deserve compassion and support. Thank you for what you are willing to do to help them flourish.